The high-pitched sound of a dentist's drill is unmistakable, never associated with pleasure and capable to unnerve even the toughest. Hearing a dentist's drill normally occurs in a dentist's waiting room or sitting in a dentist's chair, a privilege a vast majority of people do not have. In a time where periodontal disease is a major component of the global burden of chronic disease, and worldwide a staggering 60 to 90% of school children suffer from dental cavities, low and middle income countries such as Tanzania and East Africa are hit hardest. One World, One Smile, initially founded in Spain as Un Mundo Una Sonrisa and registered as an international NGO in Tanzania in 2014, has made it its mission to offer the very privilege of dental care to those who either cannot afford it or do not have access to dental treatment. Despite Tanzania's ample natural resources such as forestry, wildlife, gold, diamonds and natural gas, it still ranks amongst the poorest countries in the world. A country where HIV, AIDS, diabetes and child mortality are still some of the most common causes of death. Poor oral health is a major risk factor, weakening the immune system and allowing infections to spread easily. Tanzania's average density of dentists per head to population is 1 to 100,000 in comparison to 1 to 700 in highly developed cities. Inadequately trained staff, poor facilities, lack of money for treatment, and often very long journeys to dental clinics, if these exist at all, are the main reasons why a staggering 90% of all dental treatment results in tooth extraction. More often than not, the last option to relieve the patient from excruciating pain. By travelling to rural areas and setting up dental camps across Tanzania, One World, One Smile offers treatment to the most vulnerable of all and often is a much needed and welcomed lifeline. In September 2015, the first Dar es Salaam dental camp was set up on the busy stretch of Cocoa Beach. For Zebrania Tarimo, a mother of 3, not having had attended the Cocoa Beach dental camp would have had devastating consequences. During the checkup, a meloblastoma, a benign tumour, combined with osteomyelitis, infection of the bone, were discovered. Caused by a badly performed tooth extraction, Zebrania had been suffering from severe pains down her neck, chest and lungs for several years. One World, One Smile took immediate action and performed a 4.5-hour operation to remove this very advanced and, if not treated, deadly tumour.
Ninaona nyinyi mnafanya kazi vizuri mno kuliko hospitali zingine zote. Kwa hivyo pasipo mimi nyie kupitisha ule msaada wa kusema mtu mwenye matatizo aje Cocoa Beach, sijui labda maisha yangu mimi labda ningelikuwa labda pengine ninaenda kama kufa. Kwa hivyo mimi nasema ni asanteni sana. Lakini msiache kutangaza kana kwamba hii kliniki iko imara mno.
On just that one day on Cocoa Beach, 143 patients were seen. 92 of them received immediate medical treatment and 3 of them were referred for further treatment. In its short existence, One World, One Smile has been able to treat well over 300 people who, under different circumstances, would have been condemned to live in severe pain or worse, could have died prematurely.
Hii shughuli nzima mimi naiona inatusaidia kwa sisi ambao hatujui kama hivi watoto wanaumwa tuwapeleke wapi.
Just imagine how many children, mothers, fathers, grandmas and Zebranias One World, One Smile would be able to reach with a mobile dental clinic. A mobile clinic fully equipped and able to reach the most remote areas of Tanzania. A mobile clinic that would give thousands of people the privilege of hearing a dentist drill.
One world, one smile. One world, one smile.